Hello everyone. I'm Dr. Richard Grant. Here are 10 common mistakes when measuring blood pressure that can distort the results. Mistake 1. Rushing the patient and taking blood pressure immediately. One of the most common mistakes nurses make is rushing the patient into the room and measuring blood pressure right away. This often happens because nurses are overloaded with work, handling many patients at once, and trying to complete vital signs quickly before the doctor arrives. While this may save time for them, it creates a stressful situation for the patient. Blood pressure taken in such a rushed and stressful state will almost always be higher than the true value. Patients may then be mistakenly told they have hypertension. The solution is simple but effective. Kindly ask for a few minutes to relax before the measurement. For example, you can say, "Could you please check another patient first and then come back to me, so I can sit quietly for about 5 minutes?" This short pause allows your body to calm down, your heart rate to stabilize, and your breathing to become more regular. When the nurse returns, your blood pressure reading is far more accurate and truly reflects your actual health condition. Mistake 2. Talking during blood pressure measurement. Another frequent mistake is that nurses often multitask while taking your blood pressure. They may ask about your symptoms, complete depression screening, or start filling out paperwork while the cuff is inflating. Although nurses are very skilled at multitasking, this habit interferes with accuracy. When you are conversing during the measurement, your blood pressure tends to rise slightly because speaking activates muscles and the nervous system. Even a small increase can make the reading inaccurate. The solution is straightforward. Politely request that the nurse not talk to you while measuring. You can say something like, "Would you mind if we do the measurement in silence so the reading is as accurate as possible?" This small adjustment ensures that external factors do not interfere, giving you the most reliable numbers. Mistake 3. Blood pressure cuff too tight. A third mistake is applying the cuff too tightly on your arm. Many times, the nurse wraps the cuff around your upper arm and then pulls it hard to secure it in place. This creates excessive pressure even before inflation begins. Not only does this cause discomfort or pain when the cuff inflates, but it also skews the results. A cuff that is too tight can artificially increase blood pressure readings. The solution: ensure that the cuff is snug but not overly tight. You should be able to slip 2 fingers comfortably between the cuff and your arm. If you cannot do this, the cuff has been applied too tightly. A properly fitted cuff allows the device to inflate without causing unnecessary discomfort and produces a more precise reading. Mistake 4. Improper position, dangling arm or crossed legs. Positioning plays a crucial role in blood pressure accuracy, yet it is often overlooked. Many clinics place patients on an exam table with legs dangling or crossed, no back support, and arms not at heart level. These incorrect positions can raise readings artificially. A dangling arm, crossed legs, or unsupported back all create extra tension in the body, leading to results that suggest higher blood pressure than the patient actually has. The solution is to ensure correct posture. Sit in a chair with your feet flat on the floor, back supported, and arm resting comfortably at heart level. If the clinic automatically places you on the exam table, politely ask if you can sit in a chair instead. This small change in position makes a significant difference and helps prevent false diagnoses of hypertension. Mistake 5. Blood pressure cuff too small. One of the most overlooked yet serious mistakes is using a cuff that is too small for the patient's arm size. This is particularly common in patients who are overweight or obese, where the nurse uses a standard cuff instead of the correct larger size. A cuff that is too small will squeeze the arm more tightly and cause the reading to appear higher than it actually is, sometimes by 10 to 20 millimeters of mercury. This can result in a false diagnosis of hypertension and unnecessary treatment with medication. The solution is to make sure the cuff fits your arm size. If you have a larger arm circumference, ask for a large adult cuff or even a thigh cuff if needed. A properly sized cuff ensures that the pressure distribution is correct and the results are accurate. Mistake 6. Taking only one blood pressure reading. Another common mistake is taking blood pressure only once. Many nurses, due to time pressure, inflate the cuff, record the result, and move on without repeating. However, blood pressure can fluctuate from moment to moment depending on anxiety, posture, or even minor movement. A single measurement does not reflect the true average value. The solution is to always request at least 2 readings, taken 1 to 2 minutes apart. If the numbers are very different, a third measurement should be done, and the average of the last 2 should be recorded. This approach minimizes random fluctuations and provides a more reliable estimate of your actual blood pressure. Mistake 7. Measuring over clothes. Sometimes, to save time or avoid inconvenience, nurses place the cuff over the patient's sleeve rather than directly on the bare arm. This may seem minor, but the presence of clothing, especially thick fabric, affects the transmission of pressure and can raise readings inaccurately. Even a thin shirt sleeve can alter results enough to matter. The solution: always roll up your sleeve and ensure the cuff is placed directly on your bare skin. This guarantees that the cuff pressure is transmitted evenly to the artery, giving the most precise measurement. If your clothing is too tight to roll up, it is better to remove the arm from the sleeve altogether. Mistake 8. Not allowing enough rest before measurement. A subtle but important mistake is failing to let the patient rest before taking blood pressure. For example, a patient may have just walked briskly down the hall, climbed stairs, or rushed to make it on time for the appointment. If the measurement is taken immediately after physical activity, the reading will be higher because the heart and blood vessels are still in an active state. The solution: sit quietly for at least 5 minutes before the measurement. During this time, breathe slowly and avoid talking, texting, or checking emails. This rest period allows your cardiovascular system to settle into a resting baseline. Only then will the measurement truly represent your normal blood pressure rather than a temporary spike. Mistake 9. Talking or moving during measurement. One of the most frequent but underestimated mistakes is talking, moving, or even just shifting slightly while the cuff is inflating. Conversation, laughter, or adjusting posture activates muscles and the nervous system, which temporarily raises blood pressure. Even small movements like crossing legs or flexing the arm can increase readings by several millimeters of mercury, leading to falsely high numbers. The solution: remain completely still and silent while the cuff is inflating and deflating. Sit back comfortably, keep your feet flat on the floor, and place your arms steadily on the support surface. If you need to ask the nurse a question, wait until the measurement is finished. Silence and stillness are essential for accuracy. Mistake 10. Not recording or comparing measurements. Finally, one of the most common long-term mistakes is neglecting to track blood pressure readings or failing to compare them across different visits. Many patients rely only on what the nurse says that day and forget to keep a record. Without a consistent record, patterns such as white coat hypertension, elevated only at the doctor's office, or masked hypertension, normal at the clinic but high at home, can be missed. The solution is to always keep a log of your blood pressure values. Whether in a notebook, on your phone, or through a home blood pressure monitor app, tracking over time helps both you and your doctor identify trends. This makes diagnosis more accurate and treatment more personalized.